Firstly, I would like to begin by acknowledging the traditional owners of all the lands that we are on today for the Zoom webinar and pay my respect to the elders past, present and future. So thanks everyone for joining the June webinar for the Choosing Wisely Champion Health Services. Today we have Kitty Yu, who was a previous Choosing Wisely Health Services lead. So many of you may know her face, and she'll be speaking to us about the consumer work that we did at a couple of the health services across Australia. We'll have Kitty's presentation and it will be followed by questions and answers. So feel free to pop your questions in the Q&A or even in the chat, and I'll try to read it out later. So I'll hand over to Kitty.
Thanks, Anne-Marie. Good afternoon, everyone. As Anne-Marie said, I work for NPS Medicine Wise, and many moons ago now, I was the Choosing Wisely Health Services lead, and it was while I was in that role that we did this piece of consumer research work. So it is a real privilege to be able to share it more widely with this group again today. So cartoons like this have been around for a long time. They make fun of consumer health professional interactions and conversations, but underneath the humour, perhaps they do allude to a problem. That's what we look to find out how bad the problem actually is, what the problem actually was, and how we can play a role to address it. You would be no stranger to this slide on the principles of choosing wisely. We can't be talking about promoting the importance of conversations about unnecessary tests, treatments, and procedures without putting consumer-focused communication front and centre. Choosing Wisely Australia undertook a series of projects to enable and empower consumers to ask questions about their healthcare. The work spanned over a long period of time, so I'm going to describe them in 4 separate phases. The first phase actually began at the Choosing Wisely inaugural Consumer Roundtable. So a little bit of history then. In April 2015, the Australian chapter of Choosing Wisely was launched by NPS Medicine Wise in partnership with societies and associations. Shortly after, NPS Medicine Wise and the Consumer Health Forum hosted the inaugural Choosing Wisely Australia Consumer Roundtable. The roundtable identified opportunities and challenges for consumer engagement with the Choosing Wisely initiative. Consumers and consumer organisations believed Choosing Wisely to be an effective mechanism to support health professional consumer partnerships and culture change by encouraging consumers to initiate conversations. But it wasn't going to be easy to get this message out there to consumers. It wasn't just about printing a bunch of brochures, dropping them in consumer spaces and hope that the message will stick. Choosing Wisely, as you would all agree, is about the conversation. Choosing Wisely initiatives from other countries already has some experience with consumer campaigns. However, one of the key themes raised in the roundtable was that any messages delivered by Choosing Wisely Australia needs to be tested in an Australian context to ensure that they resonated with and are understood by Australian consumers. So with that brief firmly in mind, we went about the next phase, which is about testing the message. Testing the message means that we needed to do some groundwork to gain some insights into the barriers and enablers to productive conversations between health professionals and consumers. We need to have an understanding of how a consumer campaign should be positioned, and then to find out what creative concepts might work to get these points across. Choosing Wisely Australia partnered with an external audience insight agency to conduct this piece of qualitative research in the primary care setting. The research design included 10 in-depth interviews with medical professionals, so GPs, practice nurses and nurse practitioners, and 6 focus group discussions, so 5 with consumers and 1 with practice nurses and nurse practitioners across New South Wales and Victorian metro and regional locations. These discussions began broadly to gauge current attitudes, behaviours and barriers regarding the use of tests, treatments and procedures, and then focused on testing individual materials and ideas against a pre-drafted position statement to provide a frame of reference for the campaign against which the materials could be assessed. The research revealed that both consumers and health professionals agree that unnecessary tests, treatments and procedures are commonly undertaken, and almost everyone participating in the research had experienced this firsthand. We heard stories from consumers of why they undertook or received a referral for an unnecessary test, treatment or procedure, and we found reasons for why GPs felt they were asked for these and why they provided them even though they felt these were unnecessary. The research found 4 fundamental factors that were likely to have a direct influence on the effectiveness of communications about appropriate tests, treatments and procedures. The first is the difference in expectations between consumers and health professionals, both in terms of the outcomes of a consultation and also in terms of the level of involvement in decision making. Consumers often feel they had to get something as an outcome of a consultation, which can then be a mismatch to health professionals' expectations. The second is about previous medical experiences, specifically negative ones, which then reduces the consumer's willingness to have conversations about the necessity of tests, treatments, and procedures. The third is about the consumer-health professional relationship. We found that the more comfortable consumers feel with their health professionals, the more willing they are to question. But then there's also a tipping point when the trust is so complete that consumers feel they don't need to ask questions. And the fourth is about the inherent level of ability or knowledge in order to ask questions. Consumers are less likely to ask questions if they don't feel confident or of their baseline understanding. By far, the most prominent take-home message we found was that one of the biggest barriers for consumers to ask questions is that they do not feel like they have the permission to do so. The research also tested a number of creative concepts to determine the core communication elements and identify those that are the most effective. The campaign elements were broadly divided into 3 groups. The choosing wisely material posters, the more is not always better posters, and the it's okay to ask me questions creatives. The choosing wisely materials were based on wording and imagery focused on waste, false positives, and being careful what you wished for. These had different levels of acceptance with the participants, but overall they feel some of these concepts were disparaging to the health professional, some scared consumers, while others carried no clear call to action. The more is not always better materials came from international choosing wisely campaigns. They didn't test particularly well either. Consumers' impressions were that it was about nutrition or fitness or even mental health, and they didn't feel the humour on the posters was appropriate. Of the 3 broad groups of creative concepts, the one that performed the strongest was the "it's okay to ask me questions" ones. The reasons for this support were that these were perceived to open up the space for conversations, challenge held views about health professionals, and allow for questioning without casting doubts on the quality or accuracy of the health system. The research led us to conclude that the backbone of our consumer campaign should be focused on "it's okay to ask me questions" concept. But what questions to actually ask? this is where the complementary material in the form of the 5 questions played an important role. The 5 questions were well liked by consumers and health professionals and were perceived to empower and drive behaviour change. So phase 3 is about reaffirming the message. We want to take the guidance from phase 2 and to refine the designs of the consumer resources and complete the creatives for a consumer campaign. We also want to bring what we have learned in primary care in the last phase to test in the hospital space. The aims for this reaffirming phase of the research then were to explore the relevant characteristics of the hospital environment in communicating the Choosing Wisely message, to refine the concepts that perform the best in phase 2, and to determine what the campaign direction should take. In this phase, we used a similar methodology to phase 2. We conducted 2 focus groups with hospital service consumers in New South Wales, then 4 focus groups each at 2 hospitals, Austin Health in Victoria, and the Royal Brisbane and Women's Hospital in Queensland. The hospital focus groups were designed to capture a broad cross-section of opinions and experiences of different professions and seniority. What did we find? When compared with the primary care environment, the hospital setting brings added pressures that change the nature of consumer health professional conversations. Patient circumstances are significant factors in hospital. The fact that consumers are in a hospital suggests that their health concerns is more acute and worrying than the typical primary care visit. Consumers are also more uncertain about the condition and are more focused emotionally and physically on preparing for tests, treatments and procedures rather than questioning them. In terms of communication then, it needs to be simple and to the point because consumers just don't have the brain space to decipher abstract concepts, puns or obtuse images. Consumers also have lower expectations of being involved in their own care, placing more trust in their hospital health professionals rather than questioning them. The perception of the health professional knows best is even more pervasive in hospitals. There is a hierarchy feel to this too, with consumers more likely to pose the questions to, say, a nurse rather than a surgeon. Consumers are also reluctant to ask questions about an area of medicine they have no prior knowledge of or don't understand. In hospitals, consumers are treated by lots of different health professionals, which can make them uncertain about the best person to ask a particular question. And also the timing of these multiple interactions may not align with when consumers are ready to ask questions. All of these factors mean that the Choosing Wisely message must work harder to address consumer reluctance overall, as well as specifically encouraging consumer questions to ask questions about tests, treatments, and procedures. In terms of creative testing then, participants were shown this array of 15 creatives in the 3rd phase. The groups of concepts are similarly themed, but with differences to the imagery or the text. We found in our focus groups that all the consumers and health professionals, no matter what profession or seniority, were quite closely aligned in their responses to these concepts. The questions concept, which is the concepts on your top left-hand corner, the 8 concepts, captured attention and carried a message about asking questions. But the existing text was seen to inhibit rather than facilitate conversations because of the emphasis on the pressure of having the right question or good questions. The opposing positive negative concepts, so the 3 at the bottom, had a tendency to evoke fear among consumers, and hence messages from these creatives were seen as lost or confusing with consumers not quite sure as to what they were expected to do as a result of being exposed to the posters. The God Questions We Are Listening suite, which is the 4 that is on your right, performed the strongest and has the most potential. And I'll go into this one a little more in the next slide. So the God Questions We're Listening suite were set to invite questions and reassure us that someone will listen. The tone of these creatives was warm and welcoming, communicating an openness and receptivity between health professionals and consumers. This concept is seen to send dual messages to consumers to ask questions and to health professionals to listen. Consumers want the imagery to reflect the qualities and behaviours they feel would facilitate them asking questions. The imagery also needs to be realistic, representative of health professionals in terms of age and looks. They particularly love the idea of using photos of health professionals who work at their hospital. In terms of the call to action at the bottom, both consumers and health professionals feel this needs to be changed because as it implied there were good and bad questions when the message should be that it's okay to ask all questions. For the overall consumer engagement campaign, the goal is to make people feel empowered to have informed conversations with their health professionals by asking appropriate questions. The campaign needs to invite and encourage without obligating or pressuring. So consumers need to feel as though their questions would be welcomed, but not that they must ask questions or face lower quality of care or poorer outcomes. The campaign also needs to support and educate without judging and correcting. So consumers can shut down easily if they feel the questions are thought of as irrelevant, incorrect or bothersome, but they will be more likely to risk asking if they feel that there are no stupid questions. Interestingly, both consumers and health professionals believe that the concept should be aimed at both consumers and health professionals in hospitals. Asking questions is a message that is relevant for health professionals and consumers in order for better health outcomes to be achieved. Consumers and health professionals alike believe that while the campaign might be aimed at changing consumer behaviour, there is also the potential to influence health professionals' attitudes towards consumers, making them more receptive and responsive to questions and promoting the dialogue between the two groups. The last phase of the work was pilot testing what we learned. In the pilots, we were seeing if the elements that we have worked on actually come together to help consumers feel they have permission to ask questions and to know the types of questions to ask. The pilot was conducted at the same locations, so at Austin Health and at the Royal Brisbane and Women's Hospital. These are the final concepts which are in the pilot. They're on the slides. They are poster pairs with the first one with the God Questions We're Listening element, with real life health professionals of the hospitals as imagery, and also the call to action line of 5 questions to ask your healthcare professionals at the Choosing Wisely website. The other is the, as you recognize, the 5-question resource. The final concepts were tested as static posters with consumers waiting in high traffic areas such as outpatients and emergency departments. The pilot ran differently at the 2 hospitals due to the site constraints at the time. In one site, we were able to have the posters in situ for a few weeks, while in the other, we were only able to show them to consumers on the spot. Consumers were surveyed by hospital volunteers at each site. The pilot was small because of resourcing issues at the test sites. However, of the results that we did have, the general reception was positive. The poster pairs make consumers feel comfortable in asking questions, and most agreed that having the 5 questions in a consultation would be useful in their next visit. There were things that we learned through the pilot though. The recall of posters by consumers were low in the in situ sites. And this was attributed to the fact that posters were either separated or only one of the posters were displayed instead of a side-by-side poster pair. In all cases, posters were also tend to be buried amongst a large number of other posters and brochures. This was unfortunately outside our control because it's a hospital-driven thing, but it just highlights the importance to consider factors that are likely to impact the visibility of the campaign collateral, including the size, location, and competing materials. The use of other media, such as TV channels or patient web portals, was not trialled because they weren't available, but we felt that these may be worthwhile exploring in the future. It is also good to consider a multimodal approach to consumer campaigns that are inclusive of both passive approaches, so posters, brochures, etc., as well as active strategies such as health professional or consumer engagement sessions. We weren't able to explore the impact of the campaign from the health professional perspective. However, anecdotal feedback from some were that they did find the posters useful in holding them to account, and also as a reminder that they needed to make space for conversations with their patients. Our projects have taught us that choosing wisely messages are positively encouraging consumers to ask questions. But for these messages to be successful, it is critical that we also create environments that support the conversations and provide consumers with permission to ask questions they feel they currently lack. Our process of co-designing and testing with consumers is important because it allowed us to listen to and understand consumers' experiences before using an iterative process to create and refine our consumer engagement campaign, increasing its likelihood of success. I am sure you would agree that there is more that we can do in the area of consumer engagement. So if these researched campaign materials are of interest to your health service, I would encourage you to contact the Choosing Wisely team here at NPS Medicine Wise to see how they can assist you in getting yours. Thank you.
Thanks, Kitty. Great presentation. We have one question in the chat. Oh, no, sorry, that was just Scott posting about, so we do have the story and the posters and resources available on the Choosing Wisely website as well. So if you click on that link, you can have a look. So I'll just open the floor to any questions. You can pop it in the Q&A or in the chat as well. Okay, I don't think there's any questions, Kitty. So just to let everyone know, feel free to put your questions in, but these posters are actually available to be customised for any of our Choosing Wisely members and supporters. So whether you're a Champion Health Service or a member college or consumer group as well, we can customise these posters with photos of your staff. So feel free to email and let us know at choosingwisely@nps.org.au. I think we do have a question. Oh, Deb Latika. So I love the use of the cartoons. Well done. Will the slides be available after the webinar? Yes, they will be. And we are recording the session as well today, Deb. And Kitty, do you have any ideas for Deb's last question? How can I use them to promote further with my PHN?
I think the work that we did in the second phase was with primary care. I think a similar concept would work, having the poster pair. However, obviously understanding that, it really is about it's not about the specific photo or how a poster looks. It is about eliciting that connection that a consumer might have with a health professional, however that might be. So look, to be honest, I didn't have much to do with the PHNs, but I'm sure that if you work with the Choosing Wisely team, they might be able to customize something that might be more suitable for a primary care audience.
Thanks, Kitty, and thanks, Deb. Just feel free to email Scott and myself. I think you have both our emails. So Sarah Din has a question. So although it's ultimately up to the site, the factors you noted such as size, location, competing material of the poster displays, etc. Are there any supporting guides from Choosing Wisely as to how and where to best display the campaign materials for the sites to best maximise the visibility?
I think in our experience, when we planned the pilot, we had plans about where the posters would go, what sort of areas it should sit at, the sizing of them, and all of those things. But when it comes to the execution, what we found is that we can plan all we want here, but it really then is up to the individual sites as to what their hospital actually allow. And some of the barriers that we experienced was things like, well, they actually aren't allowed to, like one of the sites aren't actually allowed to post things on corridors because the hospital has policies about what can be posted in different places. So then they're restricted to notice boards. And of course, when everybody is allowed to only post things on notice boards, things tend to get crowded, etc. So I guess in relation to that, I would also encourage individual health services to perhaps find out what they're allowed to do or not before then coming to the team to when they're customizing something for you, so that it is something that you will find useful. I would also really encourage exploring other means of getting the imagery out, because when we spoke to the consumers, they really liked the idea of seeing it on like a patient's TV when they have all the hospital information, as maybe even a running presentation or those sorts of things. So if your health service allows those sorts of things, I would encourage you to explore that with your sort of your internal comms team and work with the Choosing Wisely team to make that happen.
Thank you, Kitty. So I think Diane Gray, your hand was up, so I'm just going to allow you to talk. We can hear you.
I want to certainly commend you on the presentation. It's really informative and useful. In visiting some of the hospitals around Queensland, not the RBWH though, the thing that has been flagged at some places, and they've already taken some action, is the education of their medical workforce in making sure that they are aware of the Choosing Wisely initiative, and for them to be able to access information from orientation onwards throughout their journey as well, making sure that they're really cognitive of the need to engage their consumers as aligned with the needs of current best practice. And I think that's been a challenge till now, even though it's only new. And I think that access to your information and brochures will really go a long way in progressing that.
Great. Thanks, Diane. Kitty, did you have any comments?
I guess it is only just to add that, we went through this vigorous process of testing these materials because we wanted to have buy-in from both consumers and health professionals. And we purposely, spread it out to 2 different sites, 2 different demographics. We've tested with allied health professionals as well as junior doctors, senior doctors, nurses, so on and so forth. So we really stood up for us is it doesn't matter who they are, what resonated to people, consumers or health professionals alike, is, those elements that I spoke about within the posters. People need to kind of feel that connection and that comfort and that permission to be able to ask questions. So I guess, we stand by the research that, it does resonate. So I think you can feel, a degree of confidence of actually having those posters and introducing them to your cohort and see what the feedback is, because it was quite, we spoke to quite a few people and it was overwhelming that's the kind of thing that they want. They didn't like any of the others. That's the one that really spoke to them. So
thanks, Kitty. I'm just going to take the last 2 questions quickly. So Suzanne's, because it leads on from this, how did you prepare the clinicians to respond to the 5 questions?
We didn't really so much in this tranche of work. This tranche of work, I guess, is mostly focused on how we speak to how the campaigns speak to a consumer. And while, the 5 questions are, an important part of that, we see that as a piece of a resource that is already widely available. It is about supporting the campaign material, which is the posters with the 5 questions, because it's well enough to say, 5 questions to ask at the Choosing Wisely website, which is the call to action of the posters. But having the actual resource side by side was found to be really effective, because then people were already having that thought front of mind and then go, right, well, the questions are right here. And so in that way, it was really kind of just focused on the consumer campaign rather than the 5 questions. But I guess having worked on the Choosing Wisely initiative for a little while before Anne-Marie took the helm, is that and I think it was also found in some of the conversations in the research as well, is that generally clinicians were supportive. Some will say, well, I already do this, responding to the questions, not specifically, divided into 5 questions, but they feel that that is already part of their day-to-day practice. But, I would be honest and say that some do resist it a little bit, citing reasons such as, it's going to take too much time in my consultation. Some would say that, there are some questions within the 5 questions that they don't really feel confident in answering. So, for example, with the GPs, they really felt that cost question was a bit prohibitive for them, because they don't always have the answers about how much a treatment might cost. And so those were some of the feedback that we received, negative feedback that we received about the 5 questions.
Okay, thanks, Kitty. And lastly, from Helen Belcher, have you had any thoughts about how the questions may be used in admission processes and associated information?
The short answer is no. We deliberately did this work wanting to produce a campaign that health services can take away and customize as they need. And we think that, having resources in this vein in admission processes and those sorts of things were really helpful, because consumers do really respond to that. It was overwhelmingly clear that consumers themselves love the 5 questions. This is not only, what we've heard anecdotally from this research, but in other things that we've done with the 5 questions, not just Choosing Wisely Australia, but, internationally. And it is about, finding within your home health service what will work, because nowadays paper might not be the best thing anymore, or so on and so forth. So hopefully it would be something that you would be able to work in with your own internal comms team. But again, the Choosing Wisely team is here to help and provide guidance and may be able to share experiences of other health services who might have done the same and found success.
Great, thanks, Kitty. So just on that note, do shoot us through an email at choosingwisely@nps.org.au. Firstly, we do have some limited copies of the 5 questions in poster forms or in wallet cards as well. And if you aren't a Champion Health Service but you're interested in finding out more, then feel free to email us. There is also some information on our website as well at choosingwisely.org.au. And yeah, there are other health services who have looked at, preparing the health professionals so that they feel that they're ready to answer questions. So touch base with me if you want to find out a little bit more. And lastly, I'm not sure who has seen the presentation, but we had Dr. Rajni Lal present on shared decision making a few months ago, and that had a strong focus on preparing health professionals so that they're actually quite proactive with asking questions and making sure that patients are comfortable. So we can send you the link to that presentation if you like as well, if you shoot us through an email. Scott, did you have anything else to add?
Just a couple things. Just on that, Dr. Lal is working on some additional resources to help training on shared decision making. So we will share those when they are available. And also for those of you who were registered for the Choosing Wisely National Meeting, just to let you know that the online portal is back live, so you can watch anything that you missed on the day. So you should have got an email if you were registered. If you weren't registered and you're interested in checking out some of that content, we hope to make some of that available starting from kind of mid-July. So watch for that through our EDMs and our social media channels and on our website. Also, just to mention that we have a few new recommendations. So the dermatologists have added a couple recommendations to their list. The nephrologists are a new society who have published 5 new recommendations. And the Faculty of Pain Medicine had a new recommendation on medicinal cannabis, which that was back in March. And we are just in the process of publishing some additional recommendations from the Thoracic Society on adult issues. So look for those on our website. That's it.
Thanks, Scott. Thanks again, Kitty. That was a fantastic presentation. Heaps of questions there. And we'll see you all on the 1st of July for our next webinar, where we'll have Champika Patullo from Royal Brizzy Women's and Children's Hospital. She'll be presenting on IV to oral, so on the project there. So we'll see you then. Thank you.